Hello, my name is Kristy Snyder. I am a member of the Ottawa Nursing faculty, and today I'm going to talk about the concept of development. This should be a review for what you've already learned about development in your PN program. You also should be using the concept of development in your current nursing practice. So why is development so important that we use it in our entire nursing career? We use development to determine if the individual is meeting appropriate milestones as they grow and mature. We use our knowledge of development to find abnormalities in development. This is not just in children, but also adults. We use development to appropriately care for individuals in different stages of life. The outcomes will help you study and prepare for the concept on the exam, but you need to be able to understand development for every concept you learn. This also carries forward to your career in nursing. Some of the objectives will be discussed in this presentation, and some of the objectives you will discover using the textbook's readings. I've also placed worksheets and resources on my Neosho to help you look at each individual stage of development. You will need to think about how you will care for and educate individuals at every different stage. The example for this concept is developmental assessment. I have listed the textbook readings and where to find them electronically. It is important for you to use your textbooks to supplement the presentation. The Concepts for Nursing Practice is found in Elsevier, and the other two textbooks are found in Lippincott-LaPointe. This picture gives a good visualization of the physical development as one goes through life. Development encompasses every aspect of changes that occur across the lifespan. As a nurse, we must know what is normal, expected development, and what is abnormal. If you can't recognize normal, you will not be able to recognize abnormal. Development is not just about infants and children. We also must recognize normal adult growth. It is not just the physical growth, but the cognitive and psychosocial we have to be concerned with also. You have to know every stage for every age of development. Even with children, each age group has distinctive developmental growth and developmental milestones. The 2-year-old has different milestones than the 8-year-old. Each is developing with different milestones, and we would treat them and educate them differently. It's the same with adults. So what are differences in the adult spectrum? We have to think about the cognitive changes as we grow older when we think about development, as well as the physical. The scope of development spans infancy to death. Its normal development is organized, progressive, and follows a predictable sequence. Across the lifespan, there are times that are particularly vulnerable periods. The person is going to be at greater risk for injury, illnesses, or negative influences. It is important for you to determine what might be problem areas for each age group. Think about this. Pause the presentation and try to determine what problems you would expect to find in each age group. So some examples. In infancy, the most common things are accidents, SIDS. The leading cause of death from the 1 to 4-year-old group is SIDS. Accidents, there's unintentional, there's intentional, there's congenital malformations, and unfortunately there is homicide. We have shaken baby syndrome and people who starve their infants. Toddlers, we expect injuries. They're into everything. They swallow something they shouldn't, putting something in their nose, their ear. The toddler stage, it's that oral fascination. These are the kids that wander out to the parents' backyard and fall in the hot tub or the swimming pool. The preschoolers, we think about injuries. Again, they're also exploring. They're into everything. They like to climb. They have problems in swimming pools. They think that they're probably better than what they really are. The school age is a time to begin experimenting, from simple things like, can you jump off the 5th stair, to doing very difficult tricks on skateboards, bikes, and leading into tobacco, drugs, and alcohol. The leading cause of death from 5 to 9-year-olds is accidents or unintentional injuries. We also see malignant neoplasms and congenital malformations. The adolescents are also exploring who they are as an individual. Social outings are extremely important. We see teen pregnancies. The leading cause of death for 10 to 14-year-old is accidents, which is unintentional, or there can be intentional self-harm like suicide. We see malignant neoplasms in this age group also. The 15 to 19-year-olds, we see unintentional accidents, we see suicide, we see assault. They may have drug overdoses. And there are so many different kinds of substances that they're taking. The young adult is the college age. Accidents are the biggest. They still have no fear. They think it won't happen to me. They like to take risks. Alcohol and drug problems. It's their first time away from home. They go away to college and they experience a little freedom and they don't make wise choices. The leading cause of death for 20 to 24 and 25 to 29-year-olds are accidents, suicide, assault, and drug overdoses. The leading cause of death for 30 to 34-year-olds is the same: accidents, suicide, malignant neoplasms. Middle adult has a higher risk for onset of chronic illnesses. We start to see high cholesterol, hypertension, diabetes, and obesity. The leading cause of death for the 35 to 44-year-olds are accidents, malignant neoplasms, and diseases of the heart. The 45 to 59-year-olds, we see malignant neoplasms, heart disease, and unintentional accidents. The older adult, which unfortunately I fall into this stage early, but still, we have the potential for falls. Our physical capabilities are decreasing. Vision, hearing, and touch are decreasing. There's a higher incidence of burns in our elderly adults from hot water because they can't feel it well. The leading cause of death for the 60 to 79-year-old are malignant neoplasms, heart disease, chronic lower respiratory diseases, COPD, emphysema. We also start seeing as people age and they get into that older adult, in the 70 to 80-year-olds, we do start seeing suicide from depression. So physical development, we look at growth and development as continuous. It's orderly, it's a sequential process. It's influenced by our maturational environment and genetic factors. The sequence of each stage is predictable. The cephalocaudal direction starts at the head and moves towards the trunk, the legs, and the feet. The proximodistal is the center of the body outward. This is why the infant can roll over before they can pick things up. Simple to complex, example, drinking from a cup. They have to be able to swallow. They have to have good eye-hand coordination. They have to be able to pick up the cup, and they have to control the tipping of the cup. They have to control the mouth and the lips and the tongue and be able to drink and swallow. Certain stages are more critical than others. The first 10 to 12 weeks after birth, if they are exposed to viruses, chemicals, and drugs, they're at greater risk than any other stage from having developmental delays. The pace of growth is uneven. Growth of the head during infancy and the growth of extremities is at puberty, and growth is highly individual. So social and emotional growth, personality development, emotions, behaviors, and interactions with others, including family, friends, and teachers, should be a lifelong process. We also have cognitive development, individuals' ability to receive information and to make sense of it. We have sensory receptions, processing and use of that information, knowing how to use the information they've processed. The information about environment and objects in the environment, as well as looking at how the individual is going to understand and apply that information. Tell a young child, don't touch that, it is hot, you're going to get burned. Their need to try something is so strong that they're going to touch it and then they get burned. They just do not have the ability to process all the information at that time. You tell an adult, don't touch that, it's hot, you'll get burned, and they won't touch it. Communication development, we see development of speech, we see articulation and pronunciation of sounds. Voice is the production of sound by the vocal cords, and the fluency of speech is the rhythm. Language is the means that is used to communicate by certain people's groups. Receptive language comes first. It's the ability to understand what others say. And we see that in infants and toddlers. They may not be able to say the words, but they know when you tell them, no, don't do that. Expressive language is the ability to express your own thoughts, ideas, and emotions. And we start seeing that more in the 2 and 3-year-olds. Adaptive development is a range of skills that allow you to live independently. There's self-care skills like dressing and undressing, feeding yourself, eating, toileting. And then there's manage of the environment. It's important that we teach our children to leave the house if it catches on fire and go to a neighbor's to call 911. Functional behaviors like crossing the street safely. Although be careful if you move from someplace like London to the US, we drive on different sides of the street. So we have to know what is safety. Following rules of politeness when interacting with others is functional behavior. You will notice in your readings that many theorists are listed. We're going to focus on one theorist today, and that's Erikson. He has 8 stages of psychological development, and as a program you will be hearing more about this, and it's on table 1.1 on page 5 in Giddens edition 3. Attributes range from expected development to abnormal development, and this is found in your Giddens book, pages 5 to 6. We have to know what is expected for normal development to recognize what is abnormal. I will just briefly talk about different stages, but you must dig deeper into your textbooks to find the inclusive picture of development. So we look at infants. They immediately form a relationship with their primary caregivers. They start interacting as they grow with others and to the environment around them. They start making sounds. They learn to sit up and roll over, and they start becoming familiar. I will say that if you are around a pregnant woman frequently and you talk to that woman, that the infant will recognize your voice after it's born. We experienced this with my middle niece. We took care of her older sister quite a bit. She was 2, and we were around my brother and sister-in-law quite a bit. My sister-in-law was pregnant with my middle niece, and after she was born, my sister-in-law was holding her, and I was walking behind her, and I said something, and man, that baby snapped her head around because she recognized my voice. So that starts in utero. So think about the development in utero and how it affects how the infants grow, their growth and development after they're born. The toddlers, they want to become independent. They might get a real attitude. They are differentiating themselves from others. They want to do it themselves. They're learning how to control body functions. Potty training's big. They're walking pretty good, and they are starting to use 1 or 2 word sentences and starting to talk pretty good and let you know what's good and what's bad. In preschool, they're identifying what their sex role There are some that get that sense of initiative pretty quickly and start to be the leaders. They start interacting with others, hopefully in socially acceptable ways, and learning to share better, and they use language for social interactions. The school age is mastering physical skills. They are building self-esteem and positive self-concept. It's really important in the school age children that we help them get that positive self-image. They're learning how to fit into peer groups, and they're starting to do some logical reasoning. The adolescents are searching for who they are. They want to be independent from their parents. They're having closer relationships with their peers. They might have some analytical thinking going on, and they might have a value system forming. And they're also developing sexual identity, and they're thinking about what they want to be when they grow up. The young adult, these are the college age students. Even if they're not going to college, they may be leaving the home for the first time. They're having to learn how to manage their own income and things like that. They're looking at a career or a vocation. They might be looking at choosing a mate, in forming an intimate relationship. There are some that are beginning that parenting role, and they might also have a meaningful philosophy of life. So the middle-aged adults are accepting and adjusting to physical changes. They're reviewing and redirecting career goals. They're going to have hobbies and leisure activities. They're going to cope with children leaving home and adjusting to aging parents. This might also be the group where they may become grandparents, and they may also be raising their grandchildren. This group might be classified as the sandwich generation because they're still taking care of children and they have their elderly parents that they're taking care of. And so they're still parents to their children, but they become more in the parenting role of their elderly parents. This is the group that is an empty nest syndrome. We see midlife crisis in this group. We also see maybe depression. We might see more divorces because the husband and wife are staying together for the children, and they've grown apart because they were so busy raising their children they don't know who they are anymore. The older adult might be adjusting to their declining physical strength and health, but that's not necessarily true. We can't categorize everybody in that. They are going to be forming relationship with people in their own peer group and probably adjusting to retirement, or hopefully thinking about retirement. Hopefully they're going to have some post-retirement activities that help them maintain their self-worth and make them feel useful. They're going to be adjusting to death of spouse, family members and friends, brothers and sisters and people their age. They might be doing a life review, and they're preparing for their own end of life. So we have to talk about risk recognition for each stage. As a nurse, you need to be able to identify the risk for each age and stage of development. If we can identify what the individual is at risk for, we hopefully can educate and help prevent the potential risk. Think about what you would teach a pregnant woman to protect her child in utero. Look at each of these on the slide and write down a list of possible risks for each. Use your textbooks to help supplement your list. So things to think about. Look at this question. Pause your video and ask, is it logical to assume that we in practice have time to do every type of assessment beyond the physical assessment by the book, utilizing a document while doing a formal assessment on every patient every day? I will say that you do have the advantage over the first semester students if you're practicing as an LPN. You know that we usually do not have the luxury of spending several hours with a form doing an all-inclusive assessment. That is why it's so important to know what is normal, and then you can discover and focus on what the abnormal is. So I talked about theoretical links. Like I said, there are numerous theories that guide nursing care related to development. Mary Graham's School of Nursing focuses on Erickson, and this is found in Giddens, page 6. So you need to look at the resource and think about Erickson. He has 8 stages of psychosocial development that you should be using on your head-to-toe assessment. Other theories that we use in this program is Knoll's learning theory, and this is an overview of adult learning processes. It's from autonomous and self-directed. It's accumulating a foundation of experiences and knowledge. Adult learning is goal-oriented, relevancy-oriented, and practical. And adult learners need to be shown respect. Knowles and Kolb both are adult learning theories, and they do talk about that it's important for the adult to figure out what is important in their education. Kolb's experiential learning focuses on reflective observation and hands-on learning. We use Tanner's model of clinical judgment, and that is noticing, interpreting, responding, and reflecting. We also use Swanson's theory of caring. Knowing, empathy, that's empathy. Being with is presence. Doing for, evidence-based practice. Enabling, empowerment to the patient. And maintaining belief, that's instilling hope. The nurse provides care based upon developmental assessment in order to facilitate the patient's optimal well-being and function. The developmental level is the position of an individual in the sequence of development. Developmental milestones are a set of functional skills or age-specific tasks that most children can complete at a certain age range. Developmental tasks are broad in scope, and they can definitely be culturally related. Developmental age is used to describe where the person is at in the developmental progress. And developmental arrest is cessation of one or more phases of development before it reaches normal completion. Whether it's in utero, a congenital anomaly, results, autism. I think of autism when I think of cessation of developmental milestones. So interrelated concepts, of course, safety is number one. We have to know how safety impacts the individual's development. We have to think about diversity and culture. And culture is not just different countries. It's maybe the neighborhood where the person lives. It could be the income class. It could be a church sect, something like that. Evidence-based practice is so important when we're looking at development. So when we think about that, we might think of certain disease processes that are that have food related, or SIDS, that we no longer want our infants to lay on the stomach. So think about these interrelated concepts in contrast to development and how they work hand in hand. And then think about developmental assessment of each age group. The worksheets will help you with that I've provided on resources. So go to resources, print off the developmental worksheets provided to you to help refresh your knowledge of development. Get in your textbooks and really dig into it and learn the developmental stages for each group. You should begin to use development in every aspect of your nursing care if you're not already doing that. Development is one of the foundational pillars that nursing is built on, along with assessment, and should be used with every patient.